One of the great things I get to do in my role is advanced pharmacy practice, to bring in pharmacy professionals to a high level of function. A couple of areas of example are precision medicine. This is an area where we help patients identify treatments that make most sense for them based on their genetic composition. So pharmacists can partner with physicians to interpret and provide recommendations on treatments. When a generic panel is done, a recommendation is oftentimes not made by the external entity, so those results have to be interpreted internally, and the pharmacist via consult service can provide those recommendations. An example would be to have a patient that would not be responding to compendia recommendation based on a mutation or a genetic composition that they may have. And so the pharmacist can assess outside of compendia a group of treatment options that would make sense, where option number 3, as an instance, could be the most toxic, so that's reserved for later on. Option number 2 is a viable option but would disqualify the patient to enroll in a treatment in a clinical trial down the line, for example. So in that case, going with option number 1 may make the most sense. So this is a great example how pharmacists can partner up to provide consult services to define treatments outside of what compendia recommendations are. This is a win-win for the patient, for the providers, and for the payers of that treatment, because obviously we don't want to invest in a treatment that is not going to be effective, and we also don't want to put patients through a treatment that they're not going to derive benefit from. So having pharmacists involved, practicing at the top of their license, is a very rewarding function of my role.